Allah, who is the most gracious and most beneficent. First of all, I'm going to introduce about myself. My name is Bisma Arshad and I'm from the Department of BS Biotechnology. And today, the topic of my discussion would be barbiturate. First of all, I'm going to tell you the major outlines of my topic, which are introduction to barbiturates, its classification, chemical properties and physical properties, its medical uses, its adverse effects, pharmacokinetics, clinical considerations, drug interactions, toxicology, regulatory issues, latest research and information. Now, moving towards my first heading, which is Introduction to Barbiturates. A group of sedative hypnotic medications known as barbiturates have been utilized for their relaxing and sleep-inducing properties. Barbiturates are a class of drugs that act as a central nervous system depressants. In the past, they were frequently employed as sedatives, hypnotics, and anticonvulsants. Gamma-aminobutyric acid (GABA), a neurotransmitter that slows down brain activity and has a soothing or sedative effect, is made more active by barbiturates. In the past, these medications were used to treat epilepsy, sleeplessness, and anxiety. However, their medical use was substantially decreased in recent years due to their great potential for abuse, severe adverse effects, and the availability of safer alternatives. Now, the action time of barbiturates varies, with some having a short half-life and others having a longer half-life. Phenobarbital, pentobarbital, and secobarbital are a few examples of barbiturates. Although certain formulations are delivered intravenously, they are normally sold as tablets or capsules. It's crucial to remember that using barbiturates entails a number of dangers, such as dependence, addiction, overdose, and potentially fatal respiratory depression. As a result, they are currently often only used in restricted medical circumstances and under close medical supervision. Now, what is the history of barbiturates? The first topic would be discovery. German chemist Adolf von Baer created barbituric acid, the molecular precursor to barbiturates, for the first time in 1864. Initially, barbituric acid only had a few uses and was mostly employed in the manufacture of dyes. Second point, sedative hypnotic properties. At the beginning of the 20th century, studies on the potential therapeutic benefits of the barbiturate started. German pharmacologist Emil Fischer and his associates created barbituric acid and a sedative hypnotic substance in 1903 by modifying barbituric acid. Barbiturates were first used as a medicinal substances as a result of this discovery. Now, moving towards next, what are its medical use? Frederick Baer, a pharmaceutical business, released Veronal barbituric acid, the first barbiturate to be sold on the open market in 1903. Veronal immediately became well liked as a sedative for treating sleeplessness and anxiety. The fourth point, market expansion for barbiturates. In the decades that followed, the market for barbiturates grew quickly. Pharmaceutical companies created novel barbituric acid compounds with various properties, which resulted in the creation of many barbiturates. These included barbiturates with short, intermediate, and long active half-lives. Now, the fifth point, therapeutic applications. Barbiturates have been used to treat a variety of illness as sedatives, hypnotics, anticonvulsants, and anesthetics. They were recommended. For instance, the long-acting barbiturate, phenobarbital, became a popular antiphylactic medication. What was its popularization? Barbiturates became widely used as both prescription pharmaceuticals and recreational drugs in the early to mid 20th century. They were frequently given for a variety of conditions such as anxiety and sleep issues. Abuse and addiction. As barbiturate use grew, So did the prevalence of abuse and addiction. Regulations to limit their usage and availability were made due to the risk of addiction and dependence. Now, what were its safety concerns? Barbiturates were associated with a range of adverse effects and risks. Overdose of barbiturates could be life-threatening, particularly when combined with other depressant substances like alcohol. Additionally, long-term use of barbiturates was found to lead to tolerance, meaning higher doses were required to achieve the desired effect. Reduction in the medical use. The use of barbiturates for medical purposes decreased as benzodiazepines gained popularity in 1960s and 1970s, offering a safer profile with lower overdose and dependence risk. Barbiturates were eventually displaced by benzodiazepines as people go to sedatives, hypnotics, and anxiolytics. So now, restricted use. Due to the risk of associated with barbiturates, their medical use has become more limited in recent years. They were now primarily reserved for specific situations, such as treatment of certain types of seizures or as a short-term anesthesia agent. Overall, while barbiturates play a significant role in the history of pharmacology and medicine, their use has declined due to safety concern and the availability of the safer alternatives. So now, moving towards my next heading, that was classification of barbiturates. There are 5 types of classification: ultra short acting barbiturates, combination barbiturates, long acting barbiturates, short to intermediate acting barbiturates. So, moving towards my first heading, ultra short acting barbiturates. These barbiturates have a very short duration of action and are primarily used as intravenous anesthetics for short surgical procedures. Examples include thiopental and mexohexetal, short to intermediate acting barbiturates. These barbiturates have a relatively short to moderate duration of action and are commonly used for sedation, induction of sleep, and treatment of seizures. Examples include pentobarbital, secobarbital, and amobarbital. Third one, long-acting barbiturates. These barbiturates have a longer duration of action and are used primarily as anticonvulsants or to treat certain sleep disorders. Examples include phenobarbital and mephobarbital. Combination barbiturates. Some barbiturates are combined with other drugs to create specific formulations. For example, the combination of secobarbital and amobarbital is known as Seconal and is used for short-term insomnia treatment. It's important to note that the specific classification of barbiturates may vary depending on the source and the specific context of use. Additionally, the use of barbiturate has significantly declined in recent years, and the alternative medications with a better safety profile are often preferred for similar therapeutic purposes. Now, moving towards my next heading, which is chemical properties. The first one will be its chemical structure. Barbiturates have a core chemical structure known as barbituric acid, which consists of pyrimidine ring fused with the urea group. Different substitutions on the pyrimidine ring can lead to the variations in the properties of specific barbiturates. Lipophilicity. Barbiturates are generally lipophilic, meaning they have an affinity for a fat-like substances. This property enables them to cross the blood-brain barrier and exert their effects on the central nervous system. Its acidic properties. Barbiturates are weak acids capable of donating a hydrogen ion proton to a solution. This characteristic affects their solubility and pharmacokinetics. Metabolism. Barbiturates are primarily metabolized in the liver by various enzymes including cytochrome P450. This metabolism results in the formation of metabolites, some of which may impose different properties and contribute to the overall effects of the drug. Sedative hypnotic effects. Barbiturates exert sedative hypnotic effects by enhancing the activity of the inhibitory neurotransmitter gamma aminobutyric acid in the brain. They bind to GABA receptors and potentiate the inhibitory actions of GABA, leading to the decrease in a neuronal activity and a calming effect. Now, heading towards its physical properties, which are solid state. Most barbiturates are crystalline solids at room temperature. The appearance and the color of the crystals can vary depending on the specific compound. Melting point. Barbiturates generally have relatively low to moderate melting points. The melting points can vary depending on the specific compound and its chemical structure. Solubility. Barbiturates are usually soluble in organic solvents such as ethanol, methanol, chloroform, and acetone. Their solubility in water can vary depending on the specific compound, with some being moderately soluble and others having low solubility. Its stability. Barbiturates can be sensitive to heat, light, oxidative conditions. They may decompose or degrade under certain conditions, which can affect their physical properties and chemical stability. Odor. Barbiturates are generally odorless or have a slight characteristic odor. The specific odor, if present, can depend upon the compound. Now, moving towards my next heading, which is mechanism of action. GABA enhancement. Barbiturates facilitate the binding of GABA and GABA A receptors, increasing the frequency of chloride ion channel opening. This leads to the influx of chloride ions into neurons, causing hyperpolarization and a reduction in the neural excitability. Potentiation of GABA effects. By enhancing GABA mediated inhibition, barbiturates increase the inhibitory tone in the brain. This results in the suppression of neuronal activity, leading to the sedative, anxiolytic, and anticonvulsant effects. Now moving towards next, modulation of excitatory neurotransmission. In addition to enhancing GABAergic inhibition, barbiturates can also modulate the activity of excitatory neurotransmitters such as glutamate. They can inhibit the release of glutamate or antagonize glutamate receptors, further contributing to their overall depressant effects. Influence on the calcium channels. Barbiturates can also interact with voltage-gated calcium channels, inhibiting calcium entry into neurons. This modulation of calcium channels may contribute to their sedative and anticonvulsant effects. Now, moving towards next, what are its medical uses? Barbiturates have been used in various medical settings for their therapeutic properties. Here are some common therapeutic applications of barbiturates, which is sedation, anesthesia, and anti-seizure medication. First of all, sedation. Barbiturates such as phenobarbital have been used for their sedative properties. They can induce a calming effect, promote relaxation, and relieve anxiety. Barbiturate sedatives were historically used for treating insomnia, but their use in this regard has decreased due to the availability of safer alternatives. Anesthesia. Barbiturates such as thiopental and mexohexatal have been used as intravenous anesthetics. These drugs can induce unconsciousness and produce a state of general anesthesia, allowing for surgical procedures to be performed. However, the use of barbiturate anesthetics has decreased with the advent of newer, safer anesthetic agents. Anti-seizure medications. Barbiturates, including a phenobarbital and pyrimidine, have been used as anti-seizure medications. They exert their effects by enhancing the inhibitory actions of GABA in the brain, thereby reducing neural excitability and preventing seizure activity. However, due to their side effect profile and the availability of more selective anti-seizure medications, barbiturates are typically reserved for specific cases where other treatments have been proven ineffective. It's important to note that the use of barbiturates in medical practice has decreased over time due to several factors, including their potential for dependence, abuse, and overdose, as well as the availability of safer alternative medications with fewer side effects. The use of barbiturates in medical settings should always be under the supervision of healthcare professionals who can carefully evaluate the risks and benefits for each individual patient. Side effects associated with the use of barbiturates. Barbiturates exert a profound depressant effect on central nervous system, leading to sedation, drowsiness, and decreased cognitive function. This can impair judgment, coordination, and reaction times, potentially leading to the accidents or injuries. Barbiturates can suppress the respiratory drive, leading to slowed breathing and inadequate oxygenation. This can be particularly dangerous in high doses or when combined with other respiratory depressants, such as alcohol or opioids. Severe respiratory depression can result in the respiratory arrest and life-threatening complications. So, risks associated with the use of barbiturates include dependence, addiction, and overdose. First of all, dependence and addiction. Prolonged use of barbiturates can lead to physical and psychological dependence. Dependence refers to the body adaptation to the presence of the drug, requiring higher doses to achieve the same effect. Addiction involves the compulsive use of the drug, despite negative consequences. Abrupt discontinuation of barbiturates after prolonged use can result in withdrawal symptoms. Barbiturates have a narrow therapeutic index, meaning that the difference between an ineffective dose and a toxic dose is small. Accidental or intentional overdose of barbiturates can lead to severe central nervous system depression and respiratory failure, coma, and even death. Combining barbiturates with other central nervous system depressants such as alcohol or opioids increasing the risk of overdose. Interactions with other medications. Barbiturates can interact with numerous medications including certain antibiotics, anticoagulants, and antileptic drugs, and hormonal contraceptives. These interactions can alter the effectiveness or toxicity of the both barbiturate and the other medication, requiring careful monitoring and adjustment of dosages. The pharmacokinetic of barbiturates involves their absorption, distribution, metabolism, and elimination within the body. Here's an overview of each process. Absorption. Barbiturates can be administered orally, intravenously, or through other routes such as intramuscular or rectal. Oral administration is the most common route. Absorption of the barbiturates from the gastrointestinal tract is generally rapid and complete. However, the gastrointestinal tract is generally rapid and complete. However, the rate and extent of absorption may be vary depending on factors such as the specific barbiturates and the factors such as specific barbiturate drug information, formulation, and individual patient factors. Now, its distribution. Barbiturates are highly lipophilic, which allows them to rapidly distribute throughout the body, including the central nervous system. They readily cross the blood-brain barrier and placental barrier, resulting in their effects on the brain and potential fatal exposure during pregnancy. Barbiturates have a large volume of distribution, meaning they distribute extensively into tissues. Metabolism. Barbiturates are primarily metabolized in the liver by hepatic microsomal enzymes. Specifically, the cytochrome P450 system. Different barbiturates may undergo varying degrees of metabolism, with some being metabolized extensively and other less so. The major metabolic pathway involves oxidation at the C5 position of the barbiturate. Ring structure. Metabolism of barbiturates can result in the formation of active metabolites or inactive metabolites with reduced pharmacological activity. Elimination. Barbiturates are eliminated from the body primarily through hepatic metabolism, with metabolites being excreted in the urine. The elimination half-life of barbiturates can vary widely between different drugs in the class. Short-acting barbiturates typically have shorter elimination half-lives, while long-acting barbiturates have longer elimination half-lives. The elimination half-life determines the duration of the drug action and the dosing frequency required. It's important to note that individual variations in pharmacokinetics can occur due to the factors such as age, liver function, kidney function, and interactions with other drugs. Monitoring of drug levels and adjustment of dosages may be necessary to optimize therapy and minimize the risk of adverse effects associated with barbiturates. Now, its clinical considerations. Several patient factors can influence the use and dosage of barbiturates. There are some important effects which are age, weight, medical history, comorbidities, drug interactions, tolerance and dependence, pregnancy and breastfeeding. Age. The age of the patient plays a significant role in the use of barbiturates. Pediatric and geriatric patients may have altered pharmacokinetics and thermodynamics compared to adults. In general, pediatric patients may require low dose of barbiturates due to their higher sensitivity and potential for increased side effects. Geriatric patients, on the other hand, may experience reduced drug clearance and increased sensitivity to barbiturates, requiring lower doses as well. Weight. Body weight is another important consideration when determining the dosage of barbiturates. Dosage calculations are often based on the milligrams per kilogram of body weight. Higher body weight may require higher doses to achieve the desired therapeutic effect, while lower body weight may necessitate lower doses to avoid excessive sedation or other adverse effects. Now, medical history and comorbidities. A patient's medical history and comorbid conditions can affect the use and dosage of barbiturates. Certain medical conditions such as liver disease or impaired liver function may result in reduced drug metabolism and require lower dose to prevent drug accumulation and toxicity. Similarly, patients with renal impairment may require dose adjustments to account for decreased drug clearance. Additionally, conditions such as respiratory disorders or porphyria may pose contraindictions or require special caution when prescribing barbiturates. Drug interactions. Barbiturates have the potential to interact with other medications. It's crucial to consider a patient's concurrent medication regimen to avoid potential drug interactions. Barbiturates can enhance the metabolism of the other drugs, leading to reduced efficacy. Conversely, some medications can inhibit the metabolism of barbiturates, resulting in increased levels and potentially enhanced side effects. Close monitoring and adjustment of doses may be necessary when barbiturates are used concomitantly with other medications. Tolerance and dependence. Prolonged use of barbiturates can lead to the development of tolerance and dependence. Patients with a history of substance abuse or addiction may require careful consideration when prescribing barbiturates to minimize the risk of misuse or withdrawal symptoms. Tapering off the medication gradually under medical supervision may be necessary to prevent withdrawal effects. Pregnancy and breastfeeding. Barbiturates can cross the placenta and may affect the developing fetus. They can also be excreted in the breast milk, potentially affecting nursing infants. The use of barbiturates during pregnancy and breastfeeding should be carefully evaluated, weighing the potential and benefits against the risk. Alternative medication or non-drug treatment options may be considered in these situations. It's crucial for the healthcare professional to thoroughly assess patient factors and individualize the dosage and treatment plan for barbiturates to ensure optimal therapeutic outcomes while minimizing the risk of adverse effects. Consulting with a healthcare provider is essential for appropriate and safe use of these medications. Drug interactions. When it comes to drug interaction, barbiturates can have significant effects when combined with the medications. Here are some important points to consider. Synergistic effects. Barbiturates can enhance the effects of other central nervous system depressants such as alcohol, benzodiazepines like, for example, diazepam, opioids, morphine, and certain antihistamines. Combining these substances can lead to excessive sedation, respiratory depression, coma, and even death. The combined effects are often greater than the sum of the individual effects, making the interaction highly dangerous. Medications that increase barbiturate metabolism. Some medications can increase the metabolism of barbiturates, leading to their reduced effectiveness. Examples include phenytoin, an anticonvulsant, rifampicin, an antibiotic, and certain herbal supplements like St. John's wort. The accelerated breakdown of barbiturates can result in decreased therapeutic effects and may require higher doses for desired outcomes. Medications metabolized by barbiturates. Barbiturates induce certain liver enzymes that are responsible for drug metabolism. As a result, they can accelerate the breakdown of various medications, reducing their efficacy. For example, barbiturate can decrease the level of oral contraceptives, warfarin, and anticoagulant, tricyclic antidepressants, and certain anti-epileptic drugs. Interaction with anesthetics, barbiturates are sometimes used as anesthetics if other anesthetics such as opioids or general anesthetics are administered concurrently. Their effect may be potentiated, leading to the increased sedation, respiratory depression, and other complications. Interaction with the antidepressants and antipsychotics. Barbiturates should generally be avoided in the combination with antidepressants and antipsychotics due to the increased risk of central nervous system depression and respiratory depression. Now, what is toxicology? Barbiturates can have toxic effects on the various organ systems, including the liver and kidneys. Here are an overview of the potential toxic effects. Liver toxicity. Barbiturates can cause liver damage, especially with a long-term or high-dose use. The toxic effects may manifest as hepatocellular necrosis, cholestasis, impaired bile flow, or hepatic failure. Symptoms of liver toxicity can include the jaundice, yellowing of the skin and eyes, abdominal pain, nausea, vomiting, fatigue, and elevated liver enzymes and blood tests. Severe cases can lead to life-threatening liver failure. Kidney toxicity. Prolonged use of barbiturates can also lead to kidney damage. The mechanism of kidney toxicity is not fully understood but is believed to involve the formation of crystals in the renal tubules. This can result in renal tubular acidosis, impaired kidney function, and acute kidney injury. Symptoms may include decreased urine output, fluid retention, electrolyte imbalances, and signs of the kidney dysfunction in laboratory tests. Now, what are its precautionary measures? It's important to note that the toxic effects mentioned above are generally associated with the chronic high dose or long-term use of barbiturates. However, individual susceptibility can vary, and even therapeutic doses can cause adverse effects in certain individuals. If you are taking barbiturates and experiences any concerning symptoms, it is crucial to seek medical attention promptly. Additionally, regular monitoring of the liver and kidney function is advisable for individuals on a long-term barbiturate therapy to detect any potential toxicity at the early age. As always, consult with a healthcare professional for comprehensive information about the potential toxic effects of the barbiturates and how they may specifically apply to our situation. Regulatory issues. Barbiturates are classified as controlled substances due to their potential for abuse and dependence. The legal and regulatory framework surrounding the use of barbiturates varies from the country to country, but here is a general overview. In the United States, barbiturates are regulated under the Controlled Substances Act (CSA) Schedule 1, 3, 4, 5 substances, depending on their medical use and potential for abuse. Schedule 2 barbiturates such as sacrobarbital and phenobarbital have an accepted medical use but also high potential for abuse, leading to severe psychological or physical dependence. Schedule 3, 4, 5 barbiturates such as butalbital have a lower potential for abuse and are subject to less stringent regulations. Internationally, barbiturates are regulated under the United Nations Single Convention on Narcotic Drugs and the Convention on Psychotropic Substances. Different countries may have their own laws and regulations regarding the use, prescription, and availability of barbiturates. It's important to consult the specific regulations of the country in question for accurate information. Prescription requirement. In most countries, barbiturates are available only by prescription from a licensed healthcare professional. They are generally prescribed for a specific medical condition, such as epilepsy or sedation in certain medical procedures. The prescription requirement helps ensure proper medical supervision and reduce the risk of misuse or abuse. Restricted access. Due to the potential for abuse and dependence, barbiturates are often subject to stricter controls and monitoring compared to other medications. The storage, distribution, and record keeping of the barbiturates may be regulated to prevent diversion or illegal use. Limited medical use. In many countries, the medical use of barbiturates has declined over the years due to the development of safer alternatives with fewer side effects and lower abuse potential. They typically reserved for specific cases where other treatments have been ineffective or contraindicated. The latest advancement and research on barbiturates including new drugs, which are new barbiturate derivatives. Research have explored the synthesis of new barbiturate derivatives with the modified chemical structures to improve their pharmacological properties such as an increased selectivity, potency, or reduced side effects. These modifications aim to enhance the therapeutic potential and minimize their abuse potential. Drug delivery methods. Efforts have been made to develop alternative delivery methods for barbiturates. This includes exploring novel formulations such as extending release formulations or transdermal patches to provide sustained release and improved dosing convenience. These advancements can help optimize drug delivery and increase patient compliance. Therapeutic applications and abuse potential and risk management. Research continues to focus on understanding the abuse potential and risk management strategies associated with the barbiturates. Efforts are made to develop abuse deterrent formulations and explore strategies to mitigate dependence and misuse. So, that's the end of my conversation, and for the further information, you can consult this reference book, which is Barbiturates Dependence, Toxicity and Abuse by Michael A. Rogawa-Whiskey and David W. Self. And all this information I collected from Wikipedia and this reference book. So if you want to have a detailed information about this topic, you can consult this book. So, thanks for your precious time and I hope it helped you in understanding. That's the end of my conversation.